Hello, Paul Nystrom here. Just want to take a couple minutes to talk about opioid overdose and Narcan and breathing for patients. Now that you have the tool Narcan to use, I just want to remind you to use that as a secondary option. So anytime you come across an overdose or anybody who's down or not breathing adequately, whether it's from an overdose or any process, breathing for them is a solution. So get out the BVM, get out the oxygen tank, start breathing for the patient, and do that first. Uh, Giving Narcan and just waiting for it to work while no one is breathing for the patient is a bad idea. The other piece of this that when it comes to opioid overdose is that if patients wake up when they're hypoxic, which means waking them up from an opioid overdose when their oxygen saturations are low, is probably more likely to make them agitated when they wake up. The reason for that is that when you're hypoxic or when your oxygen saturations are low, you're agitated. So that's whether it's an opioid overdose or anything, you're going to be agitated because your body is sort of screaming to wake up and get more oxygen. So if you squirt somebody's nose full of Narcan and they wake up and their oxygen saturations are 40%, they're probably going to be agitated because their brain is screaming for oxygen. Whereas if you come across an opioid overdose and you start breathing for the patient first and you get their oxygen saturations up to 100%, then you can give a little dose of Narcan to get them awake and breathing more, but you don't have to give them a big dose, and you can do it slowly, particularly with the medics. When they get there, they can give it IV and give a small dose instead of just slamming 2 or 4 milligrams in their nose. And the chance of them waking up agitated, we believe, would be less. This has never been studied. It's been talked to, the medical directors have talked about it, and it's theoretically makes sense, but there's not actually any good data to prove that it's true. But there's also very little downside to making sure that patients have good oxygen saturations when you waken them up with a small dose of Narcan versus giving them a big dose of Narcan. So again, I know you have another tool, but please remember to breathe for patients when they're down and then use the Narcan as a secondary option. And always reach out with questions, and thank you for the good work that you do.